April 5th, 1918. On city street corners across the country, people pick up the paper on their way to work. Every major headline is about World War I. But meanwhile, in doctors' offices and public health agencies, a different kind of report has just arrived. The report is called simply Public Health Reports. The U.S. Public Health Service puts it out every week. It helps doctors and hospitals stay up to date on the diseases circulating in the country. And tucked away in the middle, there's the mention of a mysterious flu. Quote, on March 30th, 1918, the occurrence of 18 cases of influenza of severe type from which 3 deaths resulted was reported in Haskell, Kansas. No one knows it yet, but this flu that killed 3 people in Kansas will go on to become a pandemic. The influenza outbreak of 1918 was the most deadly pandemic in modern history, killing an estimated 50 to 100 million people worldwide. It was the second most deadly outbreak of all time. The first was the plague in the 1300s. How, in a time before widespread global travel, did the influenza of 1918 spread so far, so fast?
Hi, it's Jeremy Brown.
Dr. Jeremy Brown is an emergency doctor. He treated people during the swine flu outbreak of 2009. He's written a book about the history of influenza, and he's now the director of the Office of Emergency Care Research at the National Institutes of Health. We caught Dr. Brown to ask him about the influenza outbreak of 1918. And he said, before we get to any of that, let's talk vocab. So first, what is an epidemic?
It's a disease that seems to have more cases than usual in a local region or community. Now, this doesn't in any way reference how deadly the disease is.
And the same goes for the term pandemic.
A pandemic is when that increase in cases of a disease spreads worldwide.
The influenza outbreak of 1918 was definitely a pandemic. And separately, it was a deadly one. This influenza was a novel disease, new to humans.
We know today that the 1918 influenza virus began as a bird virus and then hopped over into humans.
But we're still not sure exactly where it started spreading in humans. It could have been at a British Army camp in France. Or it might have started in China in the summer of 1918. But many medical historians believe that the virus began in the U.S., in rural Kansas, a place called Haskell County, a farming community.
In Haskell County, in one day, 18 people fell ill and 3 died. That episode was curious enough and remarkable enough to prompt a physician called Dr. Loring Minor, who was a rural doctor in Kansas, prompt him to write a report to health officials.
This is the report that lands on the desks of doctors and public health workers on April 5th, 1918. The public health reports, that one line about a weird flu.
He was clearly surprised at the large number of deaths in one day and the large number of cases in one day. We do not know any other details about the outbreak in Haskell County, but we do know that about 300 miles to the east of Haskell County was the U.S. Army's Camp Funston.
In 1918, America was fighting in World War I. And there are reports of soldiers from Camp Funston going back and forth to Haskell County. And then, in early March, the first soldier at Camp Funston reports a flu. Army bases, unfortunately, were a hotbed for contagion.
We know from pictures of the hospitals at the time that even patients who were sick were generally put into large gym-like rooms where there were tens or even hundreds of people in one small area, separated perhaps by just a cotton sheet.
The disease they got looked a lot like a standard flu, chills and a fever. The vast number of people who got it recovered normally with rest and fluids. But
What was different about the influenza then was that in a small number of cases, it attacked the lungs directly, causing patients to have difficulty breathing. And we have many, many reports of eyewitnesses who saw young men come in the morning and be dead in the afternoon as they became increasingly blue, which is a symptom that there is not enough oxygen in the blood, and they simply often expired within a few hours.
This flu is unusual because it kills otherwise healthy young men.
As soldiers moved freely between the camp, the army camp, other army camps, and the civilian world, the virus expanded outwards in waves.
Cases started popping up in other countries following the path of troop deployment. But people aren't dying in huge numbers, not yet. And then summer hits, and the virus seems to just go away on its own. Viruses don't do well in hot weather. But some people are still carrying it around inside their bodies. And then the fall comes, temperatures drop, and those remaining strains flare right back up. A second wave hits. This one will kill tens of millions of people. The disease pops up at an army camp outside Boston, Camp Devon. About 14,000 soldiers get sick, 750 die.
We have a remarkable letter from a young medical orderly whose name was Roy. He wrote the following, quote, "We eat it, live it, sleep it, and dream it, to say nothing of breathing it 16 hours a day. It beats any sight they ever had in France after a battle."
And then, again, the virus spreads from one army base to hundreds of bases worldwide, and to the cities and civilians around them.
London, Africa, it would spread to India. It was everywhere, and it struck with a ferocity that, even to this day, is hard for us to really imagine.
People are dying. And this new threat is coming on top of the war. It's the tail end of World War I.
And now to be hit with this invisible enemy that was not on the battlefronts of Europe, but it was in our very homes, wherever we were.
And these countries at war, they don't want to report how many people and how many soldiers are dying of flu. They worry it'll make them look weak. They're downplaying it. Except in one country, Spain. They're neutral in World War I, so they don't have to cover this up. They're reporting the real numbers of people infected.
Now, people mistakenly suggested that because the disease was reported in Spain, that it had originated there. It certainly had not.
People started calling it the Spanish flu. It wasn't accurate, but it stuck. Now, because most countries weren't reporting cases, global containment measures at first were virtually non-existent. 40,000 people had already died in the US over a 3-month period.
And the first thing that the doctors admitted, they said, we have no idea what's causing this pandemic. Some people suggested that it was the alignment of Saturn and Jupiter, that the planets influenced us here on Earth and gave us the flu. So that's, in fact, where we get the word influenza from. It comes from the Italian influenza meaning influence.
So doctors had no idea what was causing the pandemic, and they also had no idea how to treat it.
They generally prescribed laxatives at the time. They prescribed alcohol. The chief medical officer of the United Kingdom at the time suggested that everybody should have a sip of champagne and that will help them to overcome the flu. That was the state of medicine back in 1918.
This disease did not end because of medical intervention. But by 1919, 1 year after that first outbreak in Haskell, Kansas, the spread finally subsides. For a few reasons.
Number one, those who caught it and recovered were now immune to it. Number two, the people who had died from the disease were now out of the pool, so the vulnerable population had already died. And the third, and probably the most important reason, was because influenza is a winter disease. And as the spring of 1919 came, the disease prevalence just melted away. Fortunately, it didn't come back in that winter of 1919.
All told, 675,000 people died in the US. That is more than the total number of American soldiers who died in all the wars of the 20th century combined. Worldwide, the flu killed an estimated 50 to 100 million people. But don't underestimate the gains we've made in the past 100 years. We have antibiotics today. A lot of people who died in 1918 died from secondary infections that are now preventable. We have modern intensive care units and specialists. And we do have some weapons to fight the spread of disease that were around in 1918 and are still around today. Keep your distance, wash your hands, and wear a mask. Seriously, people, wear a mask. Thanks for watching the video version of our podcast, History This Week. Hit subscribe to never miss a new video, and listen to History This Week wherever you get your podcasts, with new episodes every Monday.